Hello, my name is Tim Chapel. I'm a dentist and I practice in the Rose City Professional Building in downtown Jackson. Today on the Medical Miracle we are going to talk about immediate dentures. An immediate denture is rather self-explanatory. It is a denture that is delivered on the day the last of your natural teeth are removed. There are two different ways to go about dentures. One is practiced by most clinics, and that is where your teeth are removed, and about 6 weeks later you come back and have a denture made. When you have an immediate denture in a private practice like mine, your denture is made in advance, and the day the last of your natural teeth are removed, the denture is put in place so that you have something that you can function with that looks very good and is very comfortable. With advancements made in dentistry today, dentures are not an inevitable part of life. For some people, however, dentures are still necessary. There are generally two reasons people go to dentures. One is due to periodontal disease, bone loss, and gum loss. There is a very strong hereditary factor at play in someone's ability to resist bone loss and periodontal disease. Another reason to go to dentures is decay. The decision to have a denture made is certainly not taken lightly. It's a life-changing experience. And here at my office, we go to great lengths to try to make it a personal experience and one that you're very much involved with, so that we can give you dentures that look like your natural teeth, give you a great smile, and function well. At our office, we use the immediate denture, meaning the day your final teeth are removed, natural teeth, you'll have your denture put in place. At some clinics, it is the practice to have your teeth removed, wait 6 to 8 weeks, and come back and have a denture made. That'll never happen here. At my office, you'll never be without teeth. I don't think there's much dignity in being without teeth for several months. The idea is we make the denture in advance. Now, I'd like to take a couple minutes and show you how we do that. A good question to ask is how we make a denture in advance. And what we do is take impressions of your teeth so we can make plaster models, such as this. And then from these models, we'll use our calipers to measure the width of your tooth and the height of your tooth. And then I go to my catalogs. I have 4 catalogs I use to select denture teeth. And we'll select the tooth that is the right size off these measurements, and we'll pick the shade that you'd like to have. I'll often ask people to bring in photographs of a smile they like so that we can duplicate that smile with your denture teeth. Here is an example of a lady who needs to have dentures made because of a very involved case of periodontal disease. In spite of her best efforts, in spite of seeing a specialist to try and keep her teeth, she unfortunately needs to have dentures made through no fault of her own. But as I mentioned earlier, we have taken impressions of her teeth so that I have models, and you'll see her natural teeth on the left. On the right, you'll see where we have removed several of the plaster teeth and set denture teeth in their place, teeth that are the same size. And as they are set, I try to arrange them so they're straight, and it will be an improved appearance when all is said and done. In these images from the profile, you will see that her teeth were somewhat crooked and overlapped. In the process of setting her remaining denture teeth, I made a point of making them straight and making her bite even. And indeed, when these dentures were delivered to her, she was very satisfied with the result, as was her husband. Now with this gentleman, his reason for needing dentures is due to decay. As you can see, he just has his front teeth left, and instead of trying to restore his mouth with crowns and implants, he made the decision to go to dentures. Now this gentleman didn't want the space between his front teeth anymore, and he wanted his teeth to be very white. I wouldn't normally pick teeth quite this white, but it's what he wanted, it's what he received, and he was very happy, and I would have to say it does look good for him. As you can see, we can do a wonderful job making dentures, but one thing to keep in mind is even with the best dentures, there's a loss of bite force. When you go from your complete natural teeth to complete dentures, you lose about 2/3 of your bite force. So you have to make concessions to things that you can and can't eat on the menu. The miracle to today's Medical Miracle segment is the advent of implants. You can see in this illustration there are 2 implants placed in the lower jaw, the mandible, with 2 attachments that will fit to the underside of the denture. This will keep the lower denture very secure, very stable. There will be no need for adhesives. And now when you eat, your denture won't slip, and you will actually regain about half of your bite force again. So now you can enjoy more things on the menu. And it's very possible you'll be able to eat salads again, you'll be able to eat a tender steak again, and your quality of life will be improved from the point of view of a healthier diet. This model of an implant-retained lower denture illustrates the implants in place and the attachments on the underside of the denture. The idea being, of course, that once these dentures are put in place, they snap in place and are very stable. Certainly you're able to remove this as you need to at the end of each day, or to clean as you deem necessary. To learn more about dentures and what is appropriate for your situation, feel free to call my office. We have a complimentary consultation when we first meet. I consider myself a conservative dentist, and I would like you to keep as many teeth as you can. But if we deem that dentures are necessary, we will take the time to explain your options to you. We'll listen to any questions you have to ensure that when we're complete, you will be happy with your smile, with your function, and you'll be comfortable with the transition from natural teeth to dentures. Thank you for tuning in to this week's Medical Miracles, and we'll see you next time.